but CCSA said that they are planning to propose some relaxation of the restriction, and they will discuss that this Friday. Thailand Center for COVID-19 Situation Administration will meet this Friday to consider easing restrictions. CCSA said that 3 major issues will be considered: reopening of schools, dining and drinking hours at entertainment venues, restaurants, and street food stalls, and proposed plans and guidelines for the easing of restrictions. For in-school classes suspended since mid-December, Dr. Twisin, the CCSA spokesperson, said that they are expected to resume in all provinces except Samut Sakhon. Alternate day class attendance, social distancing, and online learning may still be needed in schools in the 4 red zones of Bangkok, Samut Prakan, Nonthaburi, and Pathum Thani province. Easing the restrictions will be based on separating the country into different zones in line with the severity of the pandemic. Samut Sakhon is a maximum controlled and restricted area. Maximum control area include Bangkok, Samut Prakan, Nonthaburi, and Pathum Thani, while controlled areas cover 20 provinces with maximum surveillance area in 17 provinces and surveillance areas in 35 provinces. In the case of Samut Sakhon, which is the highest maximum control area, the CCSA will seek to ease restrictions on shopping malls, eateries, and markets, allowing them to operate until 9 p.m. Takeaway orders for eateries on factories which meet safety standards, and nurseries and care centers for the elderly. And for the maximum control areas such as Bangkok, Samut Prakan, Nonthaburi, and Pathum Thani, it will be proposed that pubs, karaoke bars, and eateries should be allowed to open until 11 p.m. with live music, but no dancing. Let's go to Samut Sakhon province. And the senior health official of Samut Sakhon province said the situation is still very worrisome. And he expressed serious concern over a high-risk group of about 15,000 people who are still traveling and working as normal and risking transmission of coronavirus to others. Dr. Naredrit Kattasima said that based on the assumption that there are at least 3 people in close contact with each of the 5,000 infected people already identified in the coastal province. He said that these high-risk people pose a real challenge to health officials in their efforts to contain the spread of the virus. He reiterated the need for full cooperation from factories, which hired many migrant workers, agencies supervising industrial standards in factories, and the Federation of Thai Industries, to make sure that employers strictly observe social distancing among their employees and mandate the wearing of face masks.